Hello everyone. My name is Anel Wiese, and I'm a postdoctoral researcher in medical education from UCC. And I'm delighted to have this opportunity to talk to you today at the start of your postgraduate training journey about how you will learn through work over the next few years. Today you will hear from speakers who will give you very valuable advice based on their own experiences of training. What I will talk about is what medical education research over the last few decades tells us about how doctors in training learn through work, and most importantly, what you can do as a trainee to influence your own learning. So the evidence for what I will talk about today comes from research that asks the questions, how do doctors in training learn, and how does the environment shape that learning? And this research combined input from three studies that we did. So we did a consensus building study with multiple stakeholders within postgraduate medical education. We synthesized the evidence from 90 peer-reviewed papers, and we also interviewed consultant supervisors and trainees at different clinical training sites. And through this research, we developed a model of how doctors in training learn through work. And if you'd like more information about this research, you can find it at the link shown on the screen. So when you think about your learning as a BST, the first things that probably come to mind are the formal teaching and educational sessions, either at clinical sites or here at the college. And those are important, but they play a relatively small part in your overall learning during your training. At least 80% of your learning will happen by simply doing the job of a basic specialist trainee. People often talk about service versus training as if those were two separate things, but they're not. You learn as you deliver service, as you do the job of a doctor. The two things are completely intertwined. You will learn from a lot of different people in the clinical environment, including your peers, nurses, allied healthcare professionals, and patients. But for the purposes of today's talk, I'm going to focus on your learning from doctors more senior than yourself. So this might be the consultant, but equally it could also be a senior trainee, such as a registrar or SBR. And the learning that happens through your interactions with these more senior doctors in the course of patient care is crucial for your development as a doctor. It is essential that you recognize that you have an important role to play in leading these interactions. Clinical supervision is often seen as a top-down, supervisor-led activity, but in fact, it is a two-way process, and it requires leadership from both the trainee and the supervisor. You can and you should take the lead, and by doing so, enhance your learning. Now, as I've mentioned, we developed this model about how doctors in training learn through work, and I'm going to talk through this model now, paying particular attention to the areas where you, the trainee, can strongly influence your learning. At the core of our model are the supervisor, trainee, and patient. And supervisor here refers to any senior doctor than yourself. And the interactions that happen within this triad lead to your development as a doctor. All three, the supervisor, the trainee, and the patient, don't have to be physically together for learning to occur, and typically this is not the case. So for example, a supervisor and a trainee might be discussing a case away from the bedside, or a trainee might be seeing patients by themselves. But in all of those circumstances, the missing party is always notionally present. So the key learning processes are participation, observation, and dialogue. And when these processes work effectively, they lead to the outcomes of postgraduate training. And I've listed the main ones here, such as safe participation in practice, professional identity development, learning knowledge, skills, and attitudes, learning the application of theory to practice, and effective support. So we're going to drill down into each one of these processes in turn and look at what the trainee role is in relation to each. Participating in practice gives you the opportunity to manage emerging problems, to come up with solutions, and even to make mistakes while being supported by a safety net of supervision. And this prepares you for future practice. It makes you more confident and it builds your professional identity. In effect, it makes you feel like a doctor. But participation in practice depends on two things: being entrusted to do clinical work and asking for help when you need it. So generally speaking, when you arrive as a BST into a new post, the activities you will be trusted to undertake is predetermined and based on what an SHO does in that service, rather than your own individual level of competence. So you are trusted to do these tasks on a presumptive basis. That remains the case unless something happens that leads your supervisor to withdraw that trust. In some posts, however, trainees are trusted with more complex tasks on the basis of demonstrating their trustworthiness. And there are a lot of things that you can do to show your supervisor that you are trustworthy. I will come back to that in a minute. The flip side of being trusted is that you must seek help when you need it. Now, it sounds like common sense to say that you would ask for help when you need it. But in the clinical environment, the decision to ask for help is not always straightforward. So if the patient is at risk or something is clearly outside of your scope of practice, it is straightforward. But in less clear-cut situations, it can be a tricky balancing act between preserving your credibility as a capable trainee and exposing gaps in your knowledge and skills, or contacting a senior doctor at night. But asking for help when it is appropriate builds a foundation for trust. It shows that you know your own limits. So when you do seek support, the way that you go about this can influence the outcome. So being clear about the urgency or the importance of the situation, why you are seeking help, having all the required information to hand, and having a tentative plan in place inspire trust in supervisors. Now, trusting clinical work to a trainee puts a supervisor in a position of vulnerability. So, in the early stages of a new post, you can expect that the doctors that you work with will be seeking evidence on which to make an initial judgment, which they will then adjust over time based on further experience of working with you. And it's important to recognize that supervisors consider much more than just your knowledge, skills, and experience when they are evaluating your trustworthiness. So they would also consider your integrity. Are you truthful? Do you have good intentions? Are you patient-centered? And your reliability. Are you conscientious, predictable, accountable, responsible? They will also consider your humility. Do you observe your own limits? Are you willing to ask for help? Are you receptive to feedback? And also your agency. Are you self-confident, proactive towards your work, your team, and safety? So these are all areas of your practice that you should think about. So the next process is mutual observation of practice, and this includes monitoring and modeling. So supervisors gain this information about you by monitoring your work through direct and indirect observation. And then they use that information to evaluate you and to decide what level of clinical work you can be trusted to do. You won't be directly observed very often, if at all, but there are many ways or many indirect ways in which your work will be assessed. For example, reviewing your management of patients by discussing it with you or reading the notes that you've made, and also discussing your performance with other team members and staff. At the same time, you will observe the practice of many doctors and select elements of what you see and integrate that into your own practice. And this should be an active, reflective process. So as you observe others, think about what's good about what they're doing and what isn't. Are they modeling practice the way that you would like to do it? It's particularly important to reflect on any negative behaviors that you might see, because it's easy to absorb and repeat negative behaviors without really thinking about what you're doing. But you will learn a lot through observing the practice of others, seeing communication, seeing collaboration, professionalism, humanism, and leadership. So the final process is dialogue, which includes both making meaning or sense of clinical practice and gaining information about your own performance through feedback. So dialogue about practice occurs throughout the working day in a variety of settings, formal and informal. And typically discussions around patient care take the form of questioning and answering that allows supervisors to test trainees' impression and plan for similarity with their own. And it's an important process for you to learn the logic of clinical reasoning and the nuances of applying theory to practice. Effective and motivated trainees risk asking questions, provoke discussion, solicit explanations and demonstrations, and show commitment and initiative. And also these exchanges with supervisors help you to develop a shared understanding of expectations. Of course, feedback is part of these discussions, even if it often isn't flagged as such. So you need to be alert to areas for improvement that are revealed in these discussions. Again, the level of interest and engagement of trainees will influence how much feedback they get, as well as the quality. So asking for feedback enhances its quality, while failing to do so increases the likelihood of unsolicited negative feedback. So those are the processes through which you will learn. You have influence over how they operate, but of course there are many other factors involved as well. So for example, supervisors will vary in their approach to trainees and their engagement with them. And as you rotate through different posts, you will also find that there are differences between clinical teams and clinical sites. And these relate to the kinds of clinical tasks that are available and also the quality and atmosphere within the clinical team. There will also be long-standing practices and ways in which services are run that will determine your own participation. And many of these factors are outside of your control. So in each new post, it will take you some time to get the lie of the land and to understand how things work there, and also what the learning opportunities will be. Creating some time in the first few weeks of a post to think, plan, and reflect on your learning will help you to deal with busy and stressful transitions. At the level of the health service, of the health system, the introduction of the European Working Time Directive has significantly impacted opportunities for supervisors to get to know trainees, to observe their practice, and to have dialogue with them, and so on. And while there is no doubt that the limiting duty hours has a range of benefits, the associated shift work has fractured the supervisor-trainee connection. The European Working Time Directive is here to stay, and as a trainee, that means that you have to ensure that you are maximizing your learning during the hours that you are at work. One learning opportunity you should try to maximize on is the post-take ward round. If you have seen and managed patients, it's very useful to be present when the patients and your work is being reviewed by a senior doctor. If for some reason you can't be present post-take, then you should try to follow the patient journey in another way, like for example, reading back on the case notes and so on. So to summarize, learning through supervised work is a two-way process. It's a partnership between a supervisor and a trainee, and it requires leadership from both. It works through the processes of participation, observation, and dialogue, and you can have direct influence on these processes. Learning in clinical environments is highly complex, so therefore ideal or perfect circumstances are likely to be only ever partially met. And I will finish up with a few final key messages. Take an active approach to your own learning. Reflect on learning opportunities in each new post. Reflect on your own practice and also the practice of others. Thank you.